In depth tonight, why did New York take away funding for a program aimed at saving the lives of pregnant women?
With upwards of 60 women dying every year, New York's maternal death rate remains one of the highest in the country. So what is New York doing to save the lives of these women? In depth.
So let's just take a little listen.
Caring for pregnant women and seeing them through their deliveries is Dr. Mary Alakwa's life's work. To ensure their health, she's committed to always updating her knowledge. Over the past 10 years, she relied on reports from the Safe Matherhood Initiative, a project by the American College of Obstetricians and Gynecologists, ACOG. If a woman died during pregnancy or delivery, ACOG would survey the hospital, analyze the results, and report. Says Alakwa, by reviewing what went wrong, similar tragedies can be prevented.
We have implemented at our hospital a massive transfusion protocol. We have a postpartum hemorrhage protocol.
But that program died this spring when New York pulled the funding, $250,000.
$250,000 is a drop in the bucket to save somebody's life.
ACOG's Donna Montaldo says the program was voluntary. Initially, 50 to 60% of hospitals took part, but by last year only half as many signed on. Even though the information was confidential, Montaldo believes hospitals stopped reporting because they feared liability. Locally, Albany Med, St. Peter's, Ellis, and Samaritan hospitals took part in ACOG's program. Nathan Littauer used the info but didn't report to ACOG. So now what? Will anyone be keeping an eye on these deaths? The State Health Department tells me that a huge not-for-profit healthcare consulting company called iPro is stepping in. It already does reviews for the state in other areas, and now it will be adding reviews of deadly delivery incidents at no additional cost to the state. And this time, hospitals will be mandated to report.
We are afraid that if iPro goes in and just does a chart audit, there will be no looking at, again, the medical issues for the death. We want to educate all providers.
It appears she'll get her wish. In speaking with the State Health Department, I learned that iPro will be using the same 90 survey questions that ACOG used to use, in addition to adding questions supplied by the New York City Health Department. It's part of what the Health Department calls a more complete review of all maternal deaths. The Health Department says it will analyze the data and report to doctors and hospitals, similar to what ACOG did, assuring me ACOG will have a role in designing educational materials based on iPro's findings.
It's the only way that New York State is going to be able to ensure that maternal mortality is not worsening.
Dr. Vanessa Cullens is Vice President for Medical Affairs for Planned Parenthood Federation of America. But she says reviewing deaths is only part of saving maternal lives. Because increasing numbers of pregnant women are obese or suffer other chronic illnesses, Cullens says prenatal care needs even more emphasis to save lives, adding, if money is an issue, these women must seek out social services.
A child without a mother is a horrific event.
The maternal death rate did not drop during the 10 years ACOG reviewed and reported on problems, but it didn't rise either. And as for New York's high maternal death rate, the Department of Health says New York is one of only a dozen states requiring maternal deaths be reported as such. And it notes the large and diverse population in New York. We'll have more on these issues tonight, live at 11.